We're turning attention back to health matters as the NCDC has reported that Nigeria has recorded 57 cases of Lassa fever, 12 deaths in 8 states. Let's now bring in Dr. Agbor, who is the Vice President, Medical Initiative Africa. He joins me via Zoom. Good to have you join us.
Pleasure to be here. Thank you.
Lassa fever can be really deadly. I just wanted to ask what you make of this. Year in, year out, we continue to record Lassa fever, but this time it's 8 states, 12 deaths recorded already.
Lassa fever is not new to Nigeria. Since detected in 1969, it has continued to be an endemic condition. And what we understand is that the particular carrier, the Mastomys nottinensis rat, is a type of rat, and basically it carries these viruses, and it's a part of our geographical structure. So to a large extent, transmission continues almost all year round, but it peaks during the dry season when farming activities are on the spike. So when you have people who have gone to the farm, they've picked up their produces, they are drying them up in the open, they are storing them up in barns, and rats in search for food go playing around these storage sites, depositing their urine, depositing their stool, and interacting with these storage agricultural products. In addition to that, because of we have more of our people out there in the farms, they come across and they interact, or they try to catch, kill, and eat some of these mastomyces, which are responsible for the transmission. So to a large extent, the opportunities for contact with this endemic carrier of the virus is high during the dry season, which is hopefully going to close by April.
And I'm just looking at the states here. You have Ondo, Taraba, Edo, Bauchi, Embo, Kogi, Nasarawa, and Gombe. That's like almost every region, being affected by these current cases that we have. And I'm just wondering what you think that states should start doing now in terms of ensuring that for states that have not been affected, what they should start doing now.
Well, those states should increase their public education, highlight the chances and the opportunities for transmission that their inhabitants of the states will be exposed to. This is basically, in fact, if I were to cut the story short, if we kill off all the mastomyces transmitting agents, we basically would have done away theoretically with the major source of this transmission, but that is just not possible. So we need to increase knowledge among the population. We need to say that when you store your farm produce, you need to store them in a rodent-proof area that rodents would not easily access, interact with. Even when you now go to the farms and you see some of these rodents, you should be careful with interacting with them. You should, if you kill them and you must eat them, you must wash your hand properly. You must boil and cook them properly so that all the viruses are completely eliminated to a large extent. But more importantly is the fact that we need to come up with a sustainable strategy that aligns with the standard for detection, early intervention, and treatment for patients. Because at the end of the day, what we want to prevent is people from really dying. Lassa fever is quite endemic in West Africa. It cuts across several regions, several parts of the West African region, affecting countries like Sierra Leone, Liberia, across all the way to Nigeria. And year in and out, we always would have roughly the same pattern of disease or spread epidemic, because states like Ondo, states like Edo State are very top on the list. They are almost always in the first 5, but that is because this condition is endemic. We need to deepen the knowledge of our people that, look, you have to take the steps. During the dry season, you cannot just dry your foods. If you dry them out, you cannot just leave them open. They have to be in rodent-proof containers. You have to be careful when you are handling this food. Wash your hand, hygienically handle them. And very importantly, make sure that if you come across rats, handle them carefully, wash your hand, and as much as possible, cook the meat before you eat.
And Dr. Ebuta, as we're speaking, my mind was just going to people who, especially now that a lot of people drink gari, that there are foods that you can boil, but there are foods that you cannot boil. But one thing that also caught my attention was the age group mostly affected by these new cases. I think it's 20 to 31. Is there a reason for that?
Yeah, these are highly mobile people. Yeah, these are the age group of people who are likely to be out there in the farms farming. I mean, if you get much older, you become infant. If you are too young, you may be on your way to school and all of that. So a major percentage of the farmers we have in our population are the people who belong to this age group. But it's also important to signpost the fact that as much as we would see people with symptoms, 80% of people who have Lassa fever infection either have mild symptoms or no symptom at all, but they can also continue the transmission. So there's person-to-person transmission and all of that. All of this compounded by the fact that the symptoms for Lassa fever are almost like the common malaria. So you have fever, you have malaria, you feel ill, then you have some headache. I mean, you cannot differentiate that from malaria. So to a large extent, it is quite a challenge. Increasing knowledge, deepening knowledge, increasing access to early diagnosis, strengthening our framework for diagnosis, because diagnosis is also very important. Because if you suspect everybody with malaria, few of them actually have.
And Dr. Ebuta, if I may come in here, because you raised a very critical point. You mentioned
Yes.
the symptoms of Lassa fever, malaria. Let me also add typhoid and maybe COVID to it. Almost all presenting same symptoms. I mean, how important is it that people should stop self-medicating and go to the hospital to actually get tested?
Well, interestingly, the challenge is that most of over 70% of our health sick population will present to alternative sources like the chemist, the pharmacy, and all of that. They do not usually behave as one would expect that they would go to the hospital. So it's about a health-seeking behavior culture that is a bit endemic. So we will probably need to structure that a bit. For that to happen, we need to build and strengthen our primary health care. We do have up to 30,000 primary healthcare centers. We need to find a way to strengthen these primary healthcare centers. We need to deploy technology. We also need to increase access to health insurance. The current DG is doing quite a lot in that area, but we need to step it up. Nigeria is presently at 8.5% health insurance uptake. We need to deploy technology to come close to what Ghana is doing at 70%. So there's a lot to be done. But what is important is that we do have the human resource, the capacity to do it. All we need to do is to bring all the teams together in a seamless manner and then get the kind of support we need from the key stakeholders.
Thank you so much for your time, Dr. Agbor Ebuta, the Vice
Always
President, Medical Initiative Africa. Thank you.
Thank you.